we'll just start right off with, what is the state of COVID-19 in Southern Nevada right now? And if you're able to provide, the most recent numbers on hospital beds, ventilators, that sort of thing, that'd be great as well.
Sure, Kate. Southern Nevada hospitals, just our current status and where we're at. Um, about 82% of our beds are currently occupied, with about 14.8% of those patients being COVID confirmed patients. The ICUs, we're in pretty stable shape, but we're very concerned about the current positivity rate that may quickly change our numbers. But we're at 66% occupied, and about 34.5% are COVID positive as we speak right now.
I see. And then do you have any numbers as well on ventilators or that sort of thing?
Sure. Ventilators, we're in really good shape. All the hospitals in Southern Nevada worked really tirelessly and with the support of the governor and the state to be able to acquire ventilators. We've learned a lot about ventilator use. We realize that is the last resort versus early intervention of ventilators, but we have 915 ventilators in Southern Nevada, and 31% of those are currently in use, with about 28.4% on COVID positive patients right now.
I see. And, kind of going into some of the remarks that Governor Sisolak said, and he did note the Nevada Hospital Association, noting Monday marked the highest recorded number of hospitalizations since mid-August. Then in that joint statement this morning, you, along with some others, said there is more available hospital capacity now than this time last year. And those two statements seem to contradict each other a little bit. So can you provide any clarification on that?
Absolutely. I think, what we're experiencing in the state is definitely one of our highest COVID positivity rates. But we're watching it very closely and support the governor on the concern that ultimately does translate to more hospitalizations, more deaths, unfortunately. And so we're just trying to get ahead of this and asking everyone to really do their part. As the governor mentioned, we can't do it alone. We have to do this together. And but right now we're in a stable bed capacity. We have capacity, but we just don't want to get into a surge capacity or overwhelming our hospitals. And the current positivity rate, on the way it's trending, is approaching our highest numbers and will surpass our highest positivity rate. We just want to make sure that doesn't translate and overflow our hospitals. So we want to get ahead of it early, but we've developed great surge plans collectively of all the hospitals in Southern Nevada. We've not had to execute those, and nor do we want to, and we're just asking for everybody's help. So we support the governor. People, try to stay home, limit your movements, make sure you're doing all the things that we should be doing. But right now, our positivity rate is concerning, and we're just trying to get ahead of that, especially for our economy here in Southern Nevada. We want to make sure we keep open. We've done such great work over the last 3 to 4 months, but unfortunately that's being unwound, and we're going backwards where we want to keep pushing forwards.
I see, and we're definitely going to touch on that in just a moment with the economy. But back on the statement, I guess it just seemed like, the statement was painting a bit of a different picture than the governor stated last night. But you both, everybody is in agreement that this is serious and we need to get this under control.
It is serious, and right now we're in a good position. We've worked hard to be able to get to that position, but as the governor mentioned, our hospitalizations are trending definitely in the wrong direction. We're not at our peaks that where we saw in April and then July, after the July 4th weekend. So we're just trying to avoid that and get really ahead of this. So, but we're in good shape, but that can quickly change, Kate, and we want to make sure that that doesn't put us in a reason to be able to have to roll back any type of the progress that we've made.
I see. And now kind of going into the hospital capacity again. So if there's more hospital capacity now than pre-pandemic, do you think that people are avoiding going to hospitals due to COVID, or what's your response to those individuals?
Yeah, I think we're seeing a combination of things. I think there still is a hesitancy to seek out care in certain pockets of our community, whether you're vulnerable or you're concerned about hospital safety. But I assure you, we have taken and far exceeded all the precautions and CDC guidelines for patient care in all of our hospitals. So I think there is some hesitancy to seek out care. We want to make sure that if you're sick or you're not feeling well, you have an emergency, please seek out care. We don't want to see anybody delay and do more harm. But overall, I think the mask and the social distancing is definitely having a big impact on the early signs of flu. Kate, typically we're in the middle or at the beginning of the flu, but we've seen a very mild flu season so far. I think there's been one hospitalization in the entire state related to the flu. So I think we're ahead of that as well. So we've got capacity. So I think it's a combination of all those things. People are seeking out care in the right setting. They're using telehealth. They're talking to their doctors over the phone, and they're staying home being healthy. But also the early signs of the flu, it seems to be we're ahead of that so far as well. So combination of those are putting us in a pretty good position, even though we've got COVID patients that we're treating currently in all of our hospitals.
Mm-hmm. And let's see here. Just want to make sure I'm so. When it comes to this recent surge in cases, we expected a surge in the fall, but for people asking, where are these cases coming from? Is it, fatigue, not wearing masks? Is it, holidays like you mentioned? Where is this surge coming from?
Well, as the governor mentioned, we've got the vast majority are doing all the right things and hearing all the signs and the warnings that we're bringing up. But as I move throughout the community and check on our hospitals and have dialogues, we definitely see noncompliance, and I think we all see it. And we just need to care for each other, make sure caring for our families, but also let's care about the economy too, because you heard the governor, 2 weeks. We've got 2 weeks to get this under control. It's going to be a huge task, but we need everybody to participate. So that's all we're asking. And let's just flatten this right now. Let's get ahead of it so we don't have to roll back our economy in Las Vegas. We just cannot afford to do that.
Yeah, and that leads nicely into my next question, which is, Governor Sisolak said in the next 2 weeks there needs to be a significant reversal of these trends. Do you think that's attainable based on where we're at right now?
Where we're at as far as positivity, and you heard the governor, we're right around 14%. And our public testing sites, we're seeing, unfortunately, higher numbers than that. And so I think it's a huge task to be able to bring that back in, but we can't do it alone. We need everybody to do their part and listen to the governor's advice and guidance. It will have an impact if we all do it, but I'm very concerned, Kate, that may not be an achievable task if we don't all work together. So again, we're just trying to get ahead of it. The governor's doing all he can, and all of our officials here in Southern Nevada be able to keep Nevadans safe. So that's what we're really trying to shoot for.
Sure, and that again leads nicely into my next question, which Sisolak he said we're essentially walking a tightrope between keeping the economy open, keeping the community safe, and some locals think that's kind of a double standard where okay, I have to hunker down, but tourists can go to the Strip and go to restaurants. What's from a medical standpoint, what's your message to the residents of Las Vegas who might see that as a double standard?
Yeah, I can see that viewpoint. We just need to make sure that we're doing all the things that we advise, but it is a fine line. And with the Thanksgiving approaching us and wanting to be close to family and especially indoors as the weather continues to cool, it's definitely a challenge. So we definitely need more enforcement. We need more compliance, and we're able to contact trace where those issues are. And as the governor mentioned, you'll definitely see more enforcement, more surveillance happening to be able to make sure that we don't roll back all the hard work we've done collectively here in our state. So, but it is concerning that we have folks out there that just are totally ignoring the rules, and we all see it. And please report that when you see it. That's the only way we're going to be able to correct these violations in a quick manner.
Sure. And, when it comes to compliance, our team was kind of talking about it this morning. When we go to the grocery store, at least I'm seeing a lot of people wearing masks when I'm out and about, running errands, what have you. Is there a certain area that you're seeing non-compliance?
I think we're seeing really across the board. We're definitely seeing it in closed settings where we see the contact tracing back to individuals just not doing. They don't have the sanitizers. They're not washing their hands. Or definitely have the mask, as the governor mentioned, below the nose, under the chin, and that's just not effective. So we're seeing pockets throughout the community. I know code enforcement and our public officials are cracking down on that. And as the governor mentioned, you'll see them out and about, and fines will be coming.
Mm-hmm. For sure. And uh, right before I wrap this up, because I know you have things to do, I just want to make sure I have your statement correct, kind of going back to the beginning of our conversation. I guess in layman's terms, for people watching at home, how can there be um, the most available hospital capacity than this time last year, as we're seeing a surge in cases and hospitalizations? Would you mind just explaining that one more time?
Sure, Kate. Yeah, right now we're in a good position. We've worked hard to be able to flex up our surge beds and have capacity should we have a second surge. And what the governor's saying is we want to continue to make sure that we're in a good position to be able to handle the patients that we're caring for and not have to roll back visiting hours, closing down elective surgeries, being able to keep businesses open, be able to move throughout the community. And that's really the concern. Northern Nevada definitely is experiencing a faster rate of hospitalizations than Southern Nevada. But we know that this virus does not discriminate between North and South. So we just are lessons learned that we've learned from the first surge, that a high positivity rate will definitely overflow and translate into higher hospitalizations. But we are ready. We've not had to execute any of our surge plans at this point, but we just want to make sure that the community knows that all the hospitals have capacity, but we definitely don't want to get to that 100%, 105% capacity because other economic things happen. And so we're just trying to make sure that people do their part.
Sure. So we're not necessarily in that second surge, but we're getting close.
Yeah, we're not at that second surge at this point, Kate, but we're definitely heading in that direction, and we're just trying to make sure that we all work together to get to that point. We know that the flu is out there. It will continue to be out there, especially as the weather gets colder and the winds, and those respiratory illnesses and flu-like symptoms happen. And so when you layer in flu and COVID, that's a perfect storm for overflowing and hospitals being overwhelmed with a surge of patients that we just can't handle. But we're definitely heading in that direction based off our positivity rate. And we're just wanting to make sure that we flatten that or even move it in a downwards trend to avoid that hospital capacity issues.
Got it. Thank you so much for clarifying that again. I just want to make sure I'm representing what you're saying accurately. And then just last question for you: is there anything else that you want to add about what we talked about? Anything I didn't ask about that you think is important to get across?
No, I think you did a great job covering it. I think all the hospitals have worked really collaboratively together, and we took that time when the stay-at-home order was in place to make sure that we were prepared, ready. Our therapeutics and our treatments have come a long way, and we're seeing declines in the length of stay and better outcomes than we did initially. And I think that's also contributed to the hospital capacity where we're able to treat patients more on an outpatient basis versus in the emergency department or ultimately in an ICU. So with Regeneron coming and some other therapeutics that have been able to isolate and protect the healthy cells of patients, I think that's also helped our capacity, but also the decline, at least in the trending of deaths. So we're getting better at this in treatment, and just appreciate all the healthcare workers, the doctors, the nurses, the respiratory therapists that have done an amazing job and not taken a break, really, Kate, since the beginning. We continue to work day and night caring for patients that have COVID.
Yeah, they've done a tremendous job, and I know we're all so grateful for them. Thank you so much for taking the time